Hello and welcome to our Gold Learning viewers. I'm Fiona Lang Sharp, IBCLC and Director of Communications here at Gold Learning. Well, welcome everyone to this session today. I have the pleasure of sitting down with Caroline Conneen here, and she is going to be speaking at our upcoming Gold Perinatal Conference 2018. We kick off on October 1st with a free keynote, not to be missed. So that's right, it's free and open access to everyone. You come and register. You can listen on the live day, and of course, you can always listen to the recording as well. And then as part of the conference, Caroline's going to be here, which is very exciting. She's going to be speaking on the 15th of October, which I'm very excited about. Now, again, if you can't come on that day, one of the luxuries we have here, it's going to be recorded for you as well. And Caroline will be available for questions during the live day and, of course, during our forums as well. So lots of opportunity not to be missed for Caroline. And I know she's excited about talking about this topic. We've been talking offline today, right, Caroline, about this great topic that you're going to be talking about.
Yes, we sure have.
Yeah, so it's going to be a great topic. But first of all, I'm going to get Caroline to introduce herself to you. So, Caroline, why don't you introduce yourself to our listening audience today and tell them a little bit about what you do?
Sure. Thank you so much, Fiona, for having me. So, I am a lactation consultant and a nurse practitioner, and I work in two places. I work in a community hospital where I help new families get started with breastfeeding, and I work in a pediatrician's office where I also do breastfeeding work, but do what a nurse practitioner often does and checkups and sick visits and things like that. So, pretty much anything that has to do with new moms and babies and parenting, I really, really feel passionate about those kinds of things.
Well, that's awesome. So it sounds like you're pretty busy I know I was reading your bio today as well, and it looks like you've got quite a few things that you juggle, but you just seem to have such a passion for these new families, Caroline.
Absolutely. I really, really do. I love children. I love the whole mother baby part of life. I just think it's sweet.
Oh, that's wonderful. So I'd love to ask you a little bit about what you're working on because, of course, I already know, but I want you to share it with the audience because this sounds so exciting as well.
Yes. Well, part of what I have done in the past, part of what I really began my career in was a lot of breastfeeding education and teaching. And I did teach classes for almost 20 years on a monthly basis to expectant mothers on how to breastfeed. And during that time and in my work as a consultant at the hospital, I have developed some ways that I really feel have made a difference in how successful people are with latching their baby onto the breast. And I just thought I would love to just put this in writing, and I love to write. So I have finished my book, and it is in the process of starting to be, I just am in the process of wrapping things up with a publisher, and hopefully it will be out within, who knows, 6 months or so, or however long
Sure.
it may take. But I am looking forward to that, and it's going to be Latch, Better Breastfeeding, and Beyond. So I'm very
Oh.
excited to have the opportunity to put that in print and to share and just to do anything to really promote and teach breastfeeding to new families.
Well, it's so wonderful that you've taken your years of experience, which, with teaching, and you're able to convert it into a book and have the time to do it. So kudos to you, Caroline. I know it takes a lot of work and dedication to put a book together, and it's like having a baby, except I'm sure it's a lot more intense, right? And then the anticipation of waiting for the publishing as well.
Exactly. It's very exciting. I'm thrilled.
Well, I can't wait to see that book, so I'll be keeping my eyes open for it too, Caroline. So thank you so much for sharing, what you've been up to and what you're doing besides all the day-to-day things that you get to do in your office life with your families. That's wonderful. All right,
Oh,
let's switch. Let's switch gears a little bit for a moment because we're going to talk about the conference again here at Gold Perinatal, and let's talk about your actual presentation. Perhaps you'd like to share just a couple of things that you're going to be talking about during your presentation and what you're looking forward to the delegates taking away.
Sure, thank you. So I feel passionate about skin to skin care, and it has been something that has for decades has been pretty well accepted for the preterm infant. And when in practice, I've just noticed that when this is done with full-term infants, that there are also phenomenal benefits, and it's research-based as well. So I've I really have just taken a liking to trying to do a lot with promoting this with the full-term infant, and that's really primarily the purpose of the presentation is to get out this idea that holding these babies in a nice upright position when mom's awake and alert and able to, that it really can make a difference to the baby, and especially when it's continued beyond that first bath and beyond that right after delivery.
Well, this is something that I love too, and I think I can't stress enough to my families, and a lot of them I see are in the home after they've been in the hospital. And this is something that, if things aren't going well, the phenomenon behind skin to skin is just, I mean, it's endless. And you know that, Caroline. It's just wonderful. But it seems like
Yes.
it's still underutilized in those normal babies post NICU, as it reads on your slide here. And it's a bit of a concern because you ask them if they've had skin to skin and they think that 1 hour or, just 10 minutes for some of them. They're like, oh, yeah, I got a good 10 minutes in. And I'm like, nope, that's got to be more, right?
Exactly. Exactly. Or sometimes there's even a misunderstanding of what skin to skin means. And they'll
Mm,
think that skin to skin means the baby is breastfeeding because they're skin to skin. So therefore, when I'm breastfeeding, that is skin to skin. And it is, but it isn't. So
right.
it's there's definitely more to it. So I think that we have a lot of opportunities for education, and the mothers, the new families are, I have found them to be overwhelmingly receptive
Mm.
to doing this, especially once they understand the phenomenal benefits.
Yeah, absolutely. And it's great now that we're seeing the research coming out. It'll be so great when you were talking about it during your presentation because we just need to, value that and take it into our workplaces and with our families. And you're right. I think that once they're taught, they respond, and because they so want to do this, and they want to get it right. And it's one of those things that's just wonderful to see.
I agree. I agree. And it's a great way to start the parenting journey.
Oh, yes, absolutely. Absolutely. Wow, we could talk all day, I think, about this subject, Caroline, for sure. It's been wonderful chatting with you about it today, though, and I'm so excited for your presentation here at Gold Perinatal.
Thank you. I'm excited too, and I really appreciate the opportunity.
Absolutely. Well, for all of you listening in, we have been chatting with Caroline Conneen here. She's going to be coming up here at Gold Perinatal. Don't forget, you can go to the website now, log in, and you can actually reserve your seat for the free presentation coming up on October 1st. And then, of course, you can register for the full conference with topics including this one with Caroline on the 15th, not to be missed out, but always available. Again, of course, you can listen to the recordings as well. We'll look forward to having Caroline back on the day, and of course, to our listening audience. Bye bye for now, everyone.